My name is Judy, and I've been a respiratory therapist for 32 years.
I'm Debbie Butterbaugh. I've been a respiratory therapist for 36 years now.
Hi, my name's Stacey Diamond. I've been a registered respiratory therapist for the past 12 years.
My grandfather was a coal miner by trade and also a heavy smoker. And towards the end of his life, he was receiving home care services and oxygen therapy. And one day I was visiting him and a respiratory therapist was there. Never heard of respiratory therapy. I was in pre-med and thought that that was such a unique calling to go towards and help people. And I saw what they did to my grandfather. So that was the avenue that I chose.
I have breathing problems. I had breathing problems as a child. I had croup. That was my big thing that turned into asthma as I got older. So that was probably the biggest thing that prompted me to get into respiratory.
I love taking care of patients. I always have. I really didn't know what I wanted to do, in college, but after, educating myself and coming across what a respiratory therapist does, I really enjoy the work. I love specializing in pulmonary medicine, so I think we fit well together.
We do a variety of respiratory care. We do oxygen, sleep equipment in every aspect.
We follow sleep apnea patients. We take care of their BiPAP, CPAP machines. We communicate with physician, families. We also take care of pediatric bilirubin blankets.
We also specialize in trachs. We do that a lot for our skilled nursing facilities. We do nebulizers, pretty much every aspect of respiratory.
We have a lot of flexibility with our patients, and our goal is to empower our patients with the knowledge of the respiratory equipment, the respiratory treatments, and their disease entity. What to eat, how to do some certain breathing exercises, because that gives them the confidence to take care of themselves at home and gives them a higher quality of life. I think the biggest misconception with respiratory care is that we are treatment pushers, that we go in and all you see is us doing aerosol treatments in the hospital settings, but it's really a wide spectrum of care.
A lot of them just don't even know that there are respiratory therapists.
They don't really realize that we specialize in the lungs solely. We have special training in different disease states of the lungs. COPD is probably the biggest one, but there's also asthma, pulmonary fibrosis. We are seeing that more than what we used to. And then we also, do the sleep equipment, which is obstructive sleep apnea and central sleep apnea.
I think a lot of people were surprised when they realized what a therapist actually does, especially during these times with the pandemic going on. They realize that the specialties that we have to have in regards to the equipment of the specialized equipment and the specialized care that we give and the emergency type care that were vital to sustaining someone's life.
I went out to a lady's home. She had just got set up with oxygen and she wasn't looking good. She wasn't doing well. I don't think she really wanted to be home. She was scared that she just started oxygen. She didn't understand. So, after talking with her, I helped her make some follow-up phone calls. And in the end, we ended up, calling an ambulance and getting her to the hospital. And she got that extra care that she needed, and she actually called me from the hospital to thank me that, I helped her out and pointed her in the right direction, and she's doing much better now.
I think our service is number one, honestly, because We are willing to spend time with our patients one-on-one. Everybody's different. Everybody requires something different, whether it's fitting someone for a sleep mask or talking to someone over the phone because they didn't understand the instructions or what have you. We will provide whatever service is needed to have that patient comfortable in their home on the equipment that we provided.
You're going grocery shopping and you see your patients and they're using the treatment they're supposed to, and you never saw them before shopping or out in the public, but they're actually out there and they're doing their own shopping and they're enjoying their family activities. So I think that in itself, being from a small community and seeing them out there and them recognizing you and thanking you for everything you do, that's huge.
I think patients should choose Diamonds because you have 3 fabulous respiratory therapists on call every day. Each of us sort of have our own little, specialty that we are, really good at. So one of us will always be here to help you.
I think service is probably the biggest thing that we have that other companies do not. We really do one-on-one with our patients, which you don't get with a lot of other companies.
We are there for our patients. We follow through with our patients. They know that we're a phone call away if they need anything. I think that is the most important thing for our patients out there because it's all new to them. It's scary, and having this equipment and still feeling bad and not being able to breathe or go out to family functions or shopping and stuff, we tried to give them the education and the means and the best way of doing it so that they can enjoy life as they can.